Welcome to the Jameson Files. I'm your host, Carrie Weber, and it's a great episode today. So I hope that you're tuning in, whether you're watching us on video or you're listening to us in your podcast channel. Thanks for being with us, and thanks for being a part of the Jameson Files community. Today, I'm a little giddy because I have my great friend Rachel Wall with me today. Man, if you follow dentistry, if you follow the great dental consulting companies out there at all, you know Inspired Hygiene, and you know Rachel and her team. Rachel's the CEO and founder of Inspired Hygiene, and they have been working in dental practices to elevate and build exceptional hygiene departments in dental practices for over 20 years now. Am I right, Rachel?
That's right.
So I'm excited because guess what? We're going to talk about hygiene today. And man, thank you so much, Rachel, for joining me.
My pleasure. Thank you for the invitation.
Also, just to go ahead and kick it off with a little promo for Rachel, you have just started your own podcast, correct?
Yes, that's correct.
So tell me, let's do the blurb early. I mean, let's just do it backwards. Why not?
Yeah, so it's called the Inspired Hygiene Podcast. They're really simple and easy to remember. And we really start off the podcast with hitting the hot topics, which we'll talk about a couple of those today.
Yeah.
The hot topics facing our industry as related to the hygiene department in dental practices. So we just kind of get right into it
Yeah.
and really want to give everybody some actionable things to take away to work on doing exactly what you said, just elevating their hygiene department and really how they're serving and the results that they're seeing from that piece of the practice.
Yeah, I love that. I'm excited. I'm gonna be a member of the podcast fan club. I can already tell. So
Awesome. Thank you.
congratulations on kicking that
Thank you.
off.
Thank
And
you.
yes, so that's what I want to talk about today are those those top obstacles really.
Hmm.
You and I, the Jameson Group and Inspired Hygiene, there's a lot of parallels to what
Yes.
we do. We're definitely in the same realm and working on a lot of the same things with dental practices across the country. And I perhaps this is a little bit more curiosity on my part, are the things that we feel and see as top obstacles. Are we on the same page there? Is that
Mm,
what I mean? Are there those commonalities to that level that we're all having the same conversations? We're all trying to work
yeah.
on the same things and help practices with those top obstacles. So let's just jump right in there.
Okay.
When I put you in that hot seat and I ask you, what are the top obstacles today, Rachel? What are you hearing? What do you feel like are the biggest issues that practices are facing in hygiene? What are those obstacles that come up first in your mind?
Yeah, so I think that we'll see, but I think we probably are on the same page with those because we hear them all the time from our clients and prospective clients as well. And I would say it's hiring any
Mm,
dental team member, but specifically hygiene. I would say it is reconciling the new level of hygiene compensation that is
mhm.
expected for practices to be competitive, reconciling that with the sustainability of the business end of things and the business end of the hygiene department. I would say the hot topics and some of the obstacles are where are we going with hygiene as part of the industry? Are we going to remain in the same track of traditionally trained hygienists? Are we going to move to different models in certain states? The other obstacle that we hear a lot is the ability to get patients into the hygiene schedule. So
Mm,
having enough capacity in hygiene to care for the patients that want and need recare services, preventive services, and also therapeutic services. Those are the top things that we're hearing right now, Carrie.
wow. Yep.
Hit the nail on the head, huh? Yeah.
What she said. Yes, yes. So, man, where to even begin?
Right.
So much of that all just it ties together quite a bit.
Oh yeah.
If you're short staffed, then your schedule starts to, get backlogged, and that
Hmm.
capacity issue becomes even more painful when you're trying to hire, and the demands in terms of salaries and benefits become more challenging for the practice. If you're not producing and if you're not financially healthy as a business, how can you be competitive? And I mean, I don't want to leave everybody with just, oh yeah, that's how we feel. Now what?
Hmm. Hmm.
So where do you even begin? Where do you feel like that all? what's the first step for practices that are dealing with these team management and productivity issues?
Yeah, I think it depends on where what their biggest pain point is.
Mhm.
So I would say if the biggest pain point is capacity and the fact that they're still booking 6 months out, what we know is that that affects patient retention. It can affect team retention.
Mhm.
It absolutely affects diagnosis. I mean, we kind of dive into this in a podcast episode that we've got teed up coming up soon, is this cycle that all of these things are related. You know, it's like the all and that really is true in the dental practice. You probably have a better term for it than I do, but the interdependence
Mm.
of all the different systems within the dental practice, and
Yes.
I'm sure it's similar in other businesses of, you know, when you don't have good communication, then you don't have good treatment acceptance, and then you
Yes.
don't have the production, you know, level that you want to have, and then you can't invest in equipment to get, you know, attract patients with new services. Like all these things are related, so it is hard sometimes to know where to start. But
Mm.
I would say that that is probably the first place, is to figure out where are you with that. If you're
Yes.
good, if you say, hey, we could get a hygiene patient in for scaling and root planing in 4 weeks, then you're not in a at a crisis point likely right now. But a
Right.
lot of the practices that we're seeing say we can't get anybody in for 6 months.
Yes.
And so then that becomes a huge problem, because what we have seen over the last 5 years is when that is the case, then a couple things tend to happen. One is teams tend to release any priority blocks that they had on their schedule for new
Yes.
patients and non-surgical therapy. So that has a overarching impact on the whole practice. The other thing is that a lot of times the diagnostic time that the hygienists are spending or intend to spend is not happening because they can't get patients in. Then patients aren't just magically not going to have periodontal disease because you don't have room to schedule it. And most hygienists aren't intentionally ignoring it. They're trying to treat it in a prophy. So
Yes.
that scaling time, like, right, that scaling time expands, and all of a
Yep.
sudden there's no diagnostic time. It's all scaling time. And at some point, you have to say, time out, stop the insanity. We've got to figure out a solution. And so I would say that scheduling capacity is the first place to really evaluate.
Yes. Wow, get out of my head. Because it's as you were talking, the thing I was thinking things ahead, trying and then you would
Mhm.
say the thing because we're ignoring best practices in scheduling. We're eliminating, and you are so big on building the perio aspect of a practice. You've got
Mhm.
great educational tools for that continuous development for hygienists through your website, through on your platform. And I know that you do on like every year you update one. And but when we release those blocks, when we cram patients in because we start to become reactive instead of
Yes.
proactive, and then this is exactly the same issue when I do lectures and talk about and I do lectures on the topics of reducing cancellations and no shows. I talk to the groups about we now have to unravel things that things that we did reactively coming out of COVID.
Mhm. Mhm.
And I said, it's not something that we need to feel bad about or that I'm not here to shame you about. We just need
Right.
to recognize
Yep.
we unintentionally diminish the value of appointments
Mhm.
because if a patient was like, "Oh, I have a sore throat," we're like, "Don't come in.
Mhm. Mhm. Mhm.
It's fine. No, oh, it's no big
Yep.
deal. It's no big deal that we'll just reschedule you." And now we have to reset that it is a big deal. Well, same thing in when we start to do super prophies
Yep.
instead of the true appropriate appointments for treating periodontal
Mhm.
disease. Now we're telling them there is no such thing. That they don't have a problem, that they don't need
Mhm.
that kind of continuous care.
Mhm.
And so now we have to fix it. And
Mhm.
so I just I know you said all of that already, but I love how you're saying it and how you're pointing out that it's just like looking for the root causes of the issue. A lot of
Yes.
people will call us and say, "I want you to fix this." But what they don't realize is they're wanting us to fix a symptom or a side effect of a root cause of something that's happening somewhere else. So that's a perfect example of how when you start to let your scheduling system break down how it starts to negatively impact other aspects of the practice.
Mhm.
So,
100%. And I think I've used that same term, root cause, right? We've got to get to the root cause of this. And there are lots of layers to that. And then some of the other side effects of that are dentists being frustrated with hygienists because they're running behind,
mhm,
because those systems for proactively diagnosing treatment that needs more than a prophy are, have been kind of put to the side,
mhm,
and hygienists are getting frustrated because these prophy seem getting harder and harder, and a lot of times the team can't see the forest for the trees,
yeah,
and not to toot our own horn, both of us, but that really is a huge piece of the value of having an outside eye
yeah,
on your business, is because we can see what's really going on, because we're outside of that day to day.
mhm,
And a
mhm,
lot of times team members don't know that it can be fixed,
right,
because the problem seems so overwhelming, and it's been a recurring thing. I mean, in a hygiene department, you sometimes it takes 6 months or more
mhm,
to really fix the problem,
mhm,
just because of the cycles that we're on. So I think this is something that so many can relate to. I mean, we always say we are more the same than we are different. So
yeah,
there's so many practices, you're not alone. If this is the thing that you're experiencing, if this is happening in your practice, but there are ways, like you said, to unravel this. So maybe we should talk about some of that.
yes, I would love that. I would love it.
Okay.
And I don't know if this will take us down the same road, but this will, I want to circle back talking about how to kind of start to fix these mistakes that we're
Yeah.
reactively doing. Then I want us to circle back to the salaries and the hiring
Mm,
and how important these things that we're talking about right now are for hygienists and doctors to understand. If we're gonna need, if the reality is salaries have gone up, if the reality is you're gonna be your overhead percentages in salary are gonna change. And
mhm,
you're also going to, when you find a great hygienist, you're gonna want to keep him or her.
mhm.
And
Yep.
how do we start to build from that? So I do
Mhm.
want to put a pin in that and talk about that later.
Mhm.
But yeah, what do you think? How do you think these practices can start to kind of retract
Mhm.
these bad habits that have started to take root because of
Mhm.
busyness, desperation, whatever the case may be?
Yeah, I think, and there is that, both of those things, busyness and desperation, they're trying to do the best they can. So I would say first recognize that this is a problem,
Mhm.
and then be willing to do what it takes to fix it, and know that there's not one silver bullet answer,
Yeah.
that it is a series of getting creative, being willing to do things that you haven't done before. And so I would say, and being willing to maybe go through some uncomfortable times
Mm.
to get on the other side of it. So let's talk about the schedule piece of it, because yes, if the overhead is more and hygiene's being paid more, one of the solutions to that is to expand the services that are being offered. But if
Yes.
those require additional appointments, you're right back where you started. So that's where this cycle just kind of keeps continuing. So the
Yeah.
first thing is, how can you increase capacity? And let's
Mhm.
just talk about some low hanging fruit. Sometimes we talk to practice owners, and they have not had a conversation with their current hygiene team as to whether or not they're willing to expand their hours in the practice.
Mm.
So are they willing to work an additional day? Are they willing to do that once a month? Are they willing to do it twice a month for a finite amount of time, while you look to determine, do we need to hire somebody, full time?
Mhm.
Do we have the space in the practice for that? So I'd say the first thing is trying to get creative around expanding the amount of hours that hygiene has to care for patients. So
Mhm.
first and foremost, checking in with your current team. How are they feeling about things? Are they
Mhm.
willing to, add one Friday morning a month for the next 6 months, to try to get ahead of some of this backlog and get some of those blocks in place?
Yes.
If they're not, who do they know that might be willing to help you with that?
Mhm.
Because networking and finding people within your team is better than having to go out. So who do you know that might be able to help us?
Mhm.
If there's not anybody there, Are there some temp services in your community that are, more popular than others? This is also a really great way to have a legal working interview with a hygienist to see how they might fit with your practice. So while you might say, we don't ever want to use temporary hygienists, you might really need to consider that option right now
Yeah.
to, again, kind of come out of this backlog and figure out where you need to be on the other side of that.
Hmm.
The other thing is consider assisted hygiene.
Yes.
And when I say assisted hygiene, I don't mean accelerated hygiene.
Right.
We will have an episode on that on our podcast as well, but there's a way that it can be done in a very high quality way. Just like in your practice, you likely believe that the way your doctor is working with an assistant is working well and is you can deliver high quality care. The same thing can happen in hygiene. So maybe you have an extra op one day a week where
Hmm.
you have a doctor that's off or a hygienist that's off. And so if you have a dedicated assistant for that hygienist that day, or you can bring somebody in, can you see 50% more, hygiene patients that day?
Hmm.
And really plan that out and make sure that that hygienist has a dedicated assistant if they're going to be seeing patients in a second column, but that can help. Look at your insurance participation. I'm sure you are telling your clients this all the time is could this be a good time to release some of those crappy plans that you're always frustrated dealing with that are really low reimbursing
Hmm.
and could take a bit of the pressure off in the
Hmm.
schedule to allow those patients that are are patients that fit your practice demographic better and your practice core values better, could you free up some time to care for them at a higher level? So I think getting creative, we've even talked about things like doing an all hygiene day.
Yeah.
You might do this once a month, once a quarter, where everybody's seeing hygiene patients and doctors are doing exams and they're able to get in and out of there and there's no waiting and all the assistants are helping the hygienist work out of two columns, for example. And it's just all about hygiene that day.
Yeah.
So just really do some brainstorming because otherwise here's what happens, Carrie, and you and I see this all the time is practices live in this for years
Yes.
and it creates burnout.
Hmm.
It creates lack of growth within the practice and it can really become a downer honestly for
Yeah.
the whole team. So really just be honest with yourselves and start to just put out there like, hey, can we kind of go into this just with an open mind? Like, let's
Hmm.
just throw out some things that could work.
Yeah.
Please try not to shut down and just know if there's something that you're feeling some resistance to, then it just means we just need to talk through it and like
Yes.
figure out like where are you feeling that resistance? What if we could overcome that to come up with a solution? So yeah.
Yes. I we are soul sisters. You know this, right? Because
Yes, I
these
do.
are
I do.
these are same.
Yeah.
But I also not to put like more fear mongering out there, but one of the reasons why it's important to do what you can now to remedy the issues. I mean, all of these things that this doesn't, a lot of these solutions, it doesn't have to be forever.
Right.
Some of it
Right.
can be an interim solution, especially if you're short staffed, if
Hmm.
you are so far behind, because here's the risk. If you continue to go on bogged down, so backed up, what happens if you lose a team member in the midst of
Hmm.
that?
Hmm.
And listen, there's a lot of people that know what happens because it does happen. And
Yep.
if you are not about the business of streamlining the practice, getting things at the right pace and cadence, getting the patient flow caught up and in a healthy place, it's stressful for the team, it's stressful for you, and all it takes is one person walking away from your practice to make it even worse.
Yeah.
And I know
Yes.
that's a
And
little fear mongering. I understand that, but sometimes I just want anyone that's listening, that's sticking your head in the sand, to realize your inaction is an action.
hmm.
And it's a
Hmm.
choice that's not going to do you any good in the future. So any of these steps and working with your team to look for solutions like the ones that, or even exploring the ones that Rachel just shared, like listen to this episode together.
Hmm. Yeah.
And say which one
Yeah.
sounds better to you. And the reason Rachel is presenting these as solutions is because practices are doing them and seeing success.
Mhm. That's right. That's right. And it is ironic that a lot of times practice owners or office managers aren't willing to propose these solutions because they're afraid they're going to lose a hygienist if they
Yeah.
bring it up.
Yeah.
So I would say you are also at risk of losing a team member if this doesn't get addressed.
Yeah.
And it could be a business team member because they're stressed out because all these patients are calling and fussing at them because they can't get in.
Yeah.
So yeah, your inaction is an action. And I would also say, and this is again not intentionally to layer on the fear, it is a reality though, is that if all of your diagnostic processes have gone by the wayside and it is prophy after prophy after prophy, you're also at risk for undiagnosed periodontal disease. I guarantee you it's happening in the practice, and you can look at your data and you can see that, or you can call Carrie and they can help you see that. And you're at risk for a patient going to another dentist because they can't get in, and that dentist saying you have periodontal disease
Yeah.
and you've had periodontal disease for a while.
Yeah.
And you might say, well, we've been treating it in a prophy. There's no documentation that's going to uphold that if the diagnosis hasn't been made.
That's right.
Yeah.
That's
And
right.
your inability to get patients in is not an excuse for not diagnosing and treating disease properly.
Yeah.
So there are a lot of really critical factors that are being influenced by the situation.
Yeah. I think, if it's office managers and doctors that are going to be listening to this episode the most, I would say number one, get clear on your standard of care
Yeah.
and get clear on what your standard of care is, and then evaluate whether your clinical practices, hygienists, doctors, everyone are are hitting the marks. I'm always like, just hitting the standard isn't enough. If you want to be
That's
a
the
really
minimum.
great practice, you're going well above standard.
Mhm.
So if you're one of those practices that want to be about the mantra of good to great, and you're not even hitting bare minimum of standard of care clinically, and you don't even know if your hygienists are, and you've never had that clear conversation, I would start there. Now, if you're a hygienist listening to this, and Rachel, jump on in whenever you want to give part of the pep talk here. But I would say you are in the driver's seat right now in this season of dentistry. The supply and demand for you is in your favor. That being said, if you want to be what Seth Godin would call a linchpin, which is a person that is indispensable in their work,
Mhm.
do everything that Rachel is encouraging you to do, plus a little bit more. Be that top tier percent performer in hygiene. And that again doesn't mean that you have to go be the next KOL or the next consultant for inspired hygiene. I mean, if that's your goal, make that your goal. But that can simply be you could stay in the same practice for 20 years, but you can be a life changer if you will simply
Mhm.
lean into your professional, your choice of profession. And I
Mhm.
want to encourage more and more people to be on fire about dentistry and their role in dentistry. Ann Duffy was on an episode recently, and you know how much she loves hygienists, Rachel,
Yeah.
and she just is like begging people, don't leave hygiene, don't
Yeah.
leave dentistry. If you want to try a different something in dentistry, is great, but don't leave.
Yeah.
Dentistry needs you.
We
And
yes.
but they need more people that want to do more than the bare minimum.
Yes.
I think
Yes.
that's my sermon.
Yes. So, and in other words, use your powers for good, right?
Yeah,
If you are this in demand,
yeah,
individual, and you have this in demand role, use those powers for good, and recognize that those powers and those abilities can be quickly taken away
yeah,
if they're not used for good, and if they're used for one's own gain only. And
yeah.
we believe in the triple win, right? Anything that we present and recommend for practice should be a win for the patient, for the hygienist and the team, and also the practice.
Love it.
And
Yes,
that is possible. It is very much possible.
yes,
Yeah. So we're totally on the same page with that. And I would add, Carrie, you mentioned something, and now I'm drawing a blank on this, but Let's go back to, you said you wanted to put a pin in the conversation about hygiene compensation and
Yes.
that as it relates to the scheduling piece.
Yeah. Yeah.
What
Let's do.
what were your where do you want to go
Yeah.
with that?
Well, yeah, that's perfect because, at this point, if you are behind in hygiene, so let's recap what Rachel said that, how do you increase that capacity? It's expansion of hours, exploring assisted hygiene, which again, I'm going to support that too and say a lot of you guys have the wrong idea of what assisted hygiene is. So let me just say that. So do some homework and learn about what a good assisted hygiene program looks like. Evaluate your relationship with insurance. This may be this may be the time, and be creative in all hygiene days or how you're scheduling so that you can see more hygiene perhaps some days than others to help offset that demand. Um,
Mhm.
so a lot of this of capacity is coming from the hiring issues, and with the
Mhm.
hiring issues comes salary negotiations and
Yep.
and all of those changes, and that supports a little bit of this next level performance in terms of what we can be doing. And this also can probably, I would guess, Rachel, could be really exciting for people that are looking at what are the things that we could be excited about that are happening in hygiene. So,
Mhm.
you know, I have to imagine you're having these conversations with practices a lot.
All the time. All the time.
So,
And
what are you
yeah.
hearing and what are you saying and what are you hearing?
Mhm. So what we're hearing and what's being demonstrated, and again, I do not want to generalize because there are phenomenal dentist hygienist relationships. There are phenomenal things happening in a lot of practices that you and I work with.
Mhm.
And there are also many instances where there is a disconnect between the compensation that is being requested by the hygienist and the amount of value that is being delivered. And that disconnect, that gap there is, in my opinion, what is driving some of these proposed legislation changes around dental hygiene education and licensing.
Ooh, we could have a part 2 and get
Yeah,
get you and
absolutely.
Andrew Johnston on here, and we could
Yeah,
really be talking
yeah.
about what's happening.
And he and I have two really different perspectives on this, which is
Mhm.
interesting. Not necessarily opposing perspectives, just different perspectives from different experience points of
Yeah.
experience. But I think that gap is what is driving that, because if the hygienist is showing up and is not working to the full capacity of their license and their abilities and their diagnostic, knowledge, then it tends to be a prophy bite wing cycle, right? Prophy
Mhm.
bite wing, prophy bite wing. And if everything's a prophy and bite wing, then sometimes those that are observing that are like, well, could somebody, I mean, assistants can take bite wings. In many states, assistants can polish. So what if they could also just do, we don't necessarily want to give assistants the ability to do scaling and root planning. We'll leave that to the hygienist. But what about these easier patients?
Mhm.
Can we not do that? And then it would be a lower cost. And then, so you see where this train of thought is going.
Mhm.
And so I would say that my advice is, in order to preserve the where we've gotten thus far with dental hygiene, which there's a much further way to go,
Mhm.
right? And I do support, hygienists having more independence in appropriate places.
Mhm.
I mean, you wouldn't want an RN going into the OR during surgery, right, on a
Mhm.
heart patient. They're not a surgeon, right? So I'm not suggesting that, but with appropriate education, right, them being able to work at the full scope of their license. And that is where that value matches the compensation.
Yes.
So when that compensation is matched with a hygienist showing up and bringing all of the value that they can possibly bring, meaning, education, being a diagnostic partner with the dentist, upholding and exceeding the standards of care for the practice, leading some of those standards of care in the practice, investigating and implementing adjunctive services that are beneficial to patients,
Yep.
being willing to participate in the diagnosis of restorative and ortho needs and operative needs and things like that, providing anesthesia if they have the ability to do that in their state. So
Mhm.
all of those things lend themselves to the hygienist, their value then is far exceeded by their compensation, and
Yes.
the practice owner is more than willing to meet those compensation requests.
Yes, absolutely. It's business, right? I mean, a return on investment. And if we desperately want our doctors and hygienists to have tremendous working relationships, because
Yeah,
really the practice is at its best when that is a true partnership, because then we're
absolutely.
having amazing doctor hygiene evaluations. The hygienists are participating in that co-diagnosis process,
Yeah,
and they're educating patients and teeing them up not only for restorative or cosmetic treatment, but for that lifelong relationship with practices. And the value, this patient sense of value, when we have tremendously engaged and high performing hygienists on our team, is just not even next level, it's next level. Because
yeah.
man, that those are really fun practices to walk into
Mhm.
and
Mhm.
see running,
Yep.
because there is this sense of leadership throughout the team, where everyone understands the vision, everyone understands the purpose of why we're all here, and everyone owns their role, right?
Yep.
And those are really, really special practices, and they're out there.
That's what I was gonna say. They are out there, and it really just requires, team members being willing to perform at that level
Mhm.
that is expected in those types of practices. But I will tell you, in those, that the hygienists are thriving,
Mm.
and they are rewarded according to the value that they're bringing, and they are motivated to bring a huge amount of value. It's like the rising tide lifts all ships.
Yes.
So, I'm thinking one practice in particular with six hygienists. When they see each other stepping up, they want to step up.
Yes.
So evaluate that, and if you're a hygienist, or any team member, really, in yourself, is like, am I performing at the same level even as my peers within the practice, or
Yes.
am I for some reason holding back, and being
Mhm.
willing to have a conversation about that? So yeah, those practices absolutely are out there,
Yes.
and they need to hire team members from time to time.
Yes, that's right. Yeah, I
Yep.
love that, you know, really, I always call them like a coachable culture, number one,
Yes.
like those strong teams with strong individual team members on it. There's no scarcity in there. And I love that quote, Rachel, the rising tide quote. I say it all the time.
Mhm.
I know you're so
Mhm.
surprised. It is. Think about this, everyone. Whatever role you're in, if you can walk into the practice tomorrow with the mindset of, when Rachel does great, I'm going to celebrate that. That does not
Yes.
negatively impact me and
Right.
my doctor's perception of me. I want Rachel to do great. And I could also probably learn a thing or two from Rachel. And also, if I'm doing great and Rachel's not doing great, maybe I could help Rachel.
Mhm. Mhm.
And if we have a team that not only wants to help each other be better, hold each other accountable to be better, and then celebrate when we do better.
Yes. And learn
Um,
from one another. Yeah.
yes, yeah, that's
Yeah,
a place that you can thrive and you will professionally grow.
yeah.
And I mean, my hunch is you'll really enjoy working there.
Mhm. Mhm. Yeah, we often, sometimes be in a practice with multiple hygienists, and there'll be one that's really great at, presenting fluoride, for example. And so we encourage the hygienist, instead of seeing that as a competitive thing, or thinking, well, I guess I don't know how to do that. No,
Mhm,
learn from them. Ask them, what are
mhm,
you saying?
mhm.
Because something that they're saying, or maybe part of their belief system, is coming across in a different way that is motivating patients.
Yes,
So ask them to share, what is working, and being willing to learn from that and try something different.
yes. Oh, I love it. I could talk to you for hours.
I know. This is fun.
I could talk, maybe I'll have you on again. I may have you on
Okay.
again
I
sometime.
love it.
Let's be like, "Hey, come back.
I
Let's
love
keep
it.
talking." So, some great stuff in here, if explore the way you can, if you're running behind by months and months and months, how can you increase your capacity? If you're looking to hire, what are we doing as a culture to to really be that place that hygienists can thrive. What is the standard of care, and how are we, not only as practice leaders but as the team members on those practices, honoring those standards and going above and beyond
Mhm.
those standards? And I just want to encourage everybody, if you're listening to this, I can't imagine that you're not in the dental industry. And so if you are struggling with figuring out what you love about dentistry, remember why you came here in the first place.
Mm.
And let's all fall in love with our profession again, because it
Mhm.
needs each and every one of us. And
Mhm.
man, do we all need you, Rachel. So thank you for being with me. I appreciate
Oh, my
you.
pleasure. I want to, before we leave, I want to give everybody a resource. And
Yes.
I don't know if you have drop links in the show notes or how you do that, but I'll just tell everybody. One thing is, if you go to inspiredhygiene.com under resource guides, there's a drop down and there is a standard of care worksheet. So
Love it.
everybody can download the standard of care worksheet that will give you a starting point to work with your team on developing your standard of care. And that's free. You can download that. And then the other thing I would say, if you go on our YouTube channel, I think there's a playlist that is like webinars or and our virtual growth forums. And there's one about assisted hygiene.
Oh,
So
great.
go check that out too, because that just might give you some food for thought or ways that it might work in your practice. So just wanted to offer those couple resources
Love
before we
that.
go.
So go download the standard of care document off of inspiredhygiene.com. Go find them on YouTube and find their YouTube video on assisted hygiene. I encourage you to go find the Inspired Hygiene podcast. I'm gonna follow it. We can follow it together and be groupies. And if you ever have a chance to see Rachel lecturing, I encourage you register for those classes, because you won't regret it. And find out more from their website at inspiredhygiene.com on speaking, consulting, and all of the great things that they bring to the dental profession. So Rachel,
Thank
you're
you,
the best.
Carrie.
Appreciate
Thank you
you.
so much.
And thanks to all of you for being with us. Be well, and I'll see you next time.